My name is Kayla Corbin. I am a radiation registered nurse at the Bismarck Cancer Center in Bismarck, North Dakota. I went to the University of Mary here in Bismarck, North Dakota. I started out with a pre-med degree, so I did graduate with a Bachelor's of Science degree with a biology major and a chemistry minor, and then eventually graduated with my Bachelor of Science in nursing. So I did go to school for 6.5 years. I got my first degree in 4 years. And then when med school did not work out for me and I was working on the floor as an aide, I decided to try nursing and went back to school to get my nursing degree. So normal days around the clinic are busy preparing charts for all the patients that we'll be seeing as either new consults who have been newly diagnosed with cancer, or have new areas of cancer, seeing follow-up patients, seeing patients that are currently undergoing radiation therapy for their cancer, and helping them manage their side effects throughout their radiation process. And then, answering phone calls for any concerns that patients have, and just dealing with the patients that are here in our clinic. We work 8-hour day shifts here at the clinic, and so normally about 36 to 40 hours a week. I've had the privilege of working both inpatient hospital and then now the clinic, and they are both busy, fast-paced in their own ways. So here at the clinic, you might not have as many patients scheduled in one day, but there's always a phone call coming in for a patient or different paperwork and charts that need to be done. So it is still busy and fast-paced. We do travel. We do have outreach clinics that we see patients, either new or follow-ups at either Dickinson or Minot with our 2 doctors, and we do that monthly. And then we also travel sometimes with our outreach coordinator to kind of get the Bismarck Cancer Center and what we're all about, what we do, what our foundation is for. The nurses can go and visit with the different people in the different cities around North Dakota to get that out. Lots of experience with clinicals from the University of Mary during the nursing program. Definitely that on-site interaction with the patients, doing hands-on was very important. And I also had the opportunity to do a mentorship my junior going into my senior year. So that summer, I did do so many hours. I got a mentorship at St. Alexis on the medical oncology floor and was able to experience both day shifts and night shifts with 2 different mentors. And that was very hands-on and kind of set the pace for my senior year and kind of had the advantage over the other students with that extra experience going into my senior clinicals. So initially, I as long as I remember, I always wanted to be a doctor growing up. And so that was my passion, studied hard, all through junior high, high school, got scholarship, went to Mary, like I said, did the pre-med first, and then was on the waiting list 2 years for med school. And when I never got accepted, took a semester off during that time and started working as an aide inpatient on an oncology floor as my first job, and just fell in love with oncology, with cancer patients, the relationship that you have with not only the patient themselves, but the family that is also going through their journey or that are the caretakers, and decided that maybe nursing, which had never been a thought in my mind before, was for me. And I know in my heart that I am an oncology nurse. You have to be very caring and compassionate. A lot of people can't believe that, oncology is my choice with how sad and emotional, but there's also a bright side to it. I mean, the relationships and the bonding that you have with those patients and the family, it's very fulfilling and rewarding, but you can't let the emotional part get to you. You have to just be there for that patient and their family. So you have to be very caring and compassionate to be successful as an oncology nurse. Definitely a team effort here at the Bismarck Cancer Center, not only among the 4 nurses that are in the clinic every day with our manager, but also all the different wraparound support that we have here, from the radiation therapist to our social worker and our dietitian and the doctors. It's definitely a team effort to make sure that the patient is getting the best care possible.